Fung, and I will be presenting on H&M, which is located in Stockholm, Sweden, and that's the website link. And the type of employee health promotion program I will be promoting is the Healthy Living Wellness Program, and its mission is to promote healthy eating habits and regular fitness activities for employee wellness. So a little bit about the company. The basic profile of the company is that it is a multinational fast fashion company for men, women, and children. It operates in 75 geographical regions. It was founded by Erling Persson in Sweden, and the current CEO is Helena Hemerson. The type of work that the employees do is ranges between a sales associate, product designer, consumer field specialist, software engineer, modeling, IT system administrator, collection managing, and storage management. And the main product of the company is clothing. And so the name of the country that this company is based in is Sweden, and the health profile of the country is that its population is approximately 10 million in 2020. The life expectancy based on statistics in 2017 to 2021 is that males live to about 81 years and females live to about 84 years. And 1 out of 5 residents are 65 years or more in age. The healthcare of the country is decentralized and universal healthcare by the Health and Medical Service Act. It is nationally regulated and locally administered. All legal citizens are automatically covered by the government, and 13% of employed residents have private supplemental coverage. And the various roles of government regarding healthcare is that at the national level, the Ministry of Health and Social Affairs are responsible for overall healthcare policy and regulation. At the regional level, 21 regional bodies are responsible for financing and administering healthcare to its citizens. And at the local level, 290 cities are responsible for providing long-term care for the disabled and elderly. And so the culture that can influence the health status is that citizens hold strong values to their national identity and trust their government. There is a overall promotion of healthy living, and 88% of Swedish patients in 2020 stated that they were satisfied with their medical care, and the leading causes of death are cardiovascular disease, respiratory disease, and Alzheimer's. Furthermore, there has been increasing obesity in the recent years. So communication with the CEO or HR at H&M. So unfortunately, they don't have the CEO information at H&M, but they do have the human resources information on their website, and they provide their email and phone number. And since sending an email is easier than calling an international number, I sent an email introducing myself as a UCI student majoring in public health sciences, and I also added my interests in the execution and effectiveness of wellness programs. The goal is to administer an employee health promotion program that promotes healthy eating habits and daily fitness activities. The importance of the program is that it can be used by all employees of different sectors, since there's so many different jobs, and it does not require a certain standing or set of skills. This also focuses on implementing healthy diets and fitness routines. Company benefits include that there will be better communication between the employer and the employee, and also among different company fields. There will be increasing productivity due to healthy living. So that would mean less work absences due to physical or mental health issues. And it is cost effective in saving long-term health costs, and it enhances work participation and morale, and also it improves employee retention. So employee benefits would be overall improvement of lifestyle through the provision of fitness centers, medical services, health screenings, and nutrition education. This can also increase confidence, teamwork, and productivity, and also leads to stress reduction. So for the design portion, the assessment of employee health based on the country healthcare is that the Swedish Working Hours Act of 1982 states that for a max of 40 hours per week is how much is a worker allowed to work in Sweden, up to a maximum of 50 hours, which would mean overtime per month. However, since H&M is such a global company, its insurance plans are subject to their respective countries and laws. So therefore, all the H&Ms in the United States, they are based on the United States healthcare, and so they offer medical, pharmacy, and vision coverage, as well as dental coverage. And so the average American works about 31 hours a week. However, overtime has been increasing in the recent years. And also 83% of American workers state that they suffer from work-related stress, with 76 stating that work-related stress affects their personal relationships. This also is likely to result in unhealthy living habits and coping mechanisms. And the goal is to advocate for a healthy lifestyle through nutrition, fitness, and wellness to reduce the effects of stress or preventable future diseases. And so the questions that would be used in the survey would be, what is the main cause of stress inside and or outside your job? A rating scale could be used as seen in the picture of poor, unsatisfactory, satisfactory, very satisfactory, and outstanding. What changes would you like to see to enhance the workplace morale and environment? This would be more of an open-ended question. And so the health topic implemented to the employee would be that the WHP program will promote healthy eating habits through nutrition education. This provides easy and inexpensive recipes using various food groups such as vegetables, protein, fruits, grain, and dairy. This equips employees with preventative measures against diseases, showing what foods are good and what foods to avoid, especially since cardiovascular disease is one of the leading causes of death. And so specifically, this program would be implemented with regular health and wellness seminars that will present education on maintaining a healthy lifestyle and provide booklets to all employees. Fitness and or resting areas will be created for employees to relax amidst the busy work hours. And I also proposed a fitness day that would happen once every 3 months, where various departments will compete against each other in physical activities for prizes, for like products that are on the market, or financial incentives. And so the evaluation of the program, for this program, it will be evaluated by surveys given to employees that can be taken online. This would include a rate system, questionnaires, feedback form, and there would also be incentives to complete surveys. Like if 95% of employees complete the survey, that they would get maybe like a gift card or a free luncheon or something like that. And it also measures work participation in the provided programs. The program would be evaluated by measuring work participation in the provided programs. And so I expect that the program will probably have less or little responses when first implemented, but there will be slow progression within the first 1 to 2 years, and there will be high employee satisfaction and participation in the programs than in previous years. And so on how to evaluate and on how to measure the evaluation for the employees, this would be sent via emails online or physical QR codes posted around the office, and they'll be given to employees. And like I said earlier, there would be incentives to complete these surveys. And for the CEO themselves, they will have full access to the employees' feedback, and those maintaining the WHP program will consolidate and present feedback information to the CEO once every 3 months, whether it is good findings or bad findings. And so for my own personal thoughts and opinions is that H&M is a global corporation with workplaces in many different regions and with a variety of different jobs. And so the Swedish healthcare is very successful, but because they also focus on not only the equal worth of the individual, but also the equal right to receive healthcare. The company will see an increase in healthy living and workplace morale with the WHP program. And benefits to the company if they continue with the program is that there will be enhanced work morale and employee satisfaction. This will also reduce employee retention, and it's also cost effective in the long run because there will be less health problems to pay for the employees. And the benefits for the employee, if they want to continue with the program, is that they can maintain a healthy diet and be provided with fitness centers or routines, and they will also have improved sleep,